Hi, this is Vince. Vince with Top Doctor, and we're here with Dr. Richard Gaines today. Dr. Richard Gaines is most famous for his method, kind of invention, a medical method for the treatment of ED or erectile dysfunction. Um, the treatment currently has his name out of this with the brand, so we can only use his actual name, Dr. Richard Gaines. Once again, most doctors in America will know who he is because many people are familiar with this ED therapy, which uses primarily acoustic wave therapy. And now Dr. Gaines has a new method patent that's actually filed already, and it's pending, and it's using this acoustic wave therapy plus shock wave therapy, which is really kind of neat, and it's going to revolutionize ED therapy as we know it. Can you tell us a little bit about that, Dr.
Yeah,
Gaines?
you mentioned both radial and focused. The radial shock waves or soft shock waves are not really even shock waves. Generally, these are sound waves that go much faster than sound waves. They go over 1,100 feet per second, whereas sound waves are much slower. But sound waves have a biphasic appearance, so there's a positive and negative part of the curve. When when there's a when a shock wave actually is mostly positive, so you get a positive inflection in microseconds, 10 microseconds. It peaks and then comes down, very minimal, if any, negative deflection. Now that's a real shock wave. I used initially when I developed the methodology earlier, I used what was called a radial shockwave generator. It's really a radial pulse wave generator because the wave is different. It's a positive wave that goes up much slower, not in nanoseconds but microseconds. So it takes longer to get high, and then it comes down and has a negative deflection as well. The curves look much different. All the studies showing that shockwave therapy works for erectile dysfunction were done with a focused wave machine. So there's 45 studies that were done in Europe, they were done in Germany.
There's been 45 studies?
45 studies on even more now in Europe, Japan, Denmark. A lot of significant studies in Israel.
What about in the USA?
In the USA, there haven't been any until there was a meta-analysis published in 2017. Department of Urology in the University of Miami, Baylor, and University of San. It was a collaborative study, University of San.
So it's a very recent U.S. study published.
2017.
On focus wave.
What they did is they took all 40 studies and they cherry-picked the ones that were double-blinded, randomized, sham-controlled. They accumulated 600 patients, and they showed that focused shockwave therapy worked for erectile dysfunction.
Wow.
So
If they classify that, they'll say significant improvement and all of these things.
exactly,
Okay.
and that's
good.
The conclusion is significant improvement. And for Americans to say that about any European study is pretty impressive. There are ongoing studies now, and I'm in touch with Dr. Ramasamy at the University of Miami. He's doing a phase 3 study on a focused wave generator. It's a generator made in Israel, but it's a focused wave, and I hear his results are very good. They have been good because he's at phase 3. So my new methodology is a bit different. As I was saying, focused wave focuses under the skin at some level. It can be focused at any level. Whereas radial technology, all the energy is delivered to the surface of the skin. It enters the skin and the body and loses energy. So in a way, there is a difference.
But the focus wave then can go much deeper, and you can kind of set where it's going to go. I want to go an inch in, 3 inches in.
Correct.
4 inches.
All the energy is directed below the skin. That's the difference, because by hitting the surface of the skin with a radial wave, you'll put all the.
So this begs the question: this might be very effective for females.
Well, I know it was for females.
I know we're not talking about females here, but it seems like
there is no study on females yet, and
because females' organs are internal and the males' organs are mostly external.
right, but there are blood flow issues with females as well. They're human beings also, and they have similar issues with blood flow. So and secretions, et cetera, et cetera. I know that this works for female sexual dysfunction in many ways. It's not just at the surface level. I actually think that because of the delivery of this energy, that it can influence wiring that has been formed over the years. We're getting a little advanced, but
Yeah, I got it, but it's called, the way you filed the patent was dual stem.
dual stem.
So you're gonna use both methods.
I'm going to combine both radial and focused.
Because you already had tremendous success with the other product associated
Just
with your
radio.
name, with the Radio Shack.
Radial is also a medical class 1 device. I chose it because medical
A
class
chiropractor could use it.
Yes, you can write a prescription, and actually a patient could buy it if they have $20,000. But it's a low-level medical device. Now, the Focus Wave is a medical class 3. You need to be a nurse practitioner, a physician, or directing. You have to be there.
In some states, certified under the equipment and under what they call controlled practice of medicine or something like that.
Maybe I'm not sure.
Different per state, right?
Yeah, it's different, but it's definitely a medical class 3, which is a higher, more technical level of medical.
So could we do one more disclaimer so that the people understand? Dr. Gaines is very famous for the treatment of erectile dysfunction. We can only use his name per a settlement he has, and everybody is friends apparently.
Yep.
So nobody can stop you from using your name, Dr. Richard Gaines.
Yeah, we can call it Dr. Gaines methodology.
Yeah, so you would call it Dr. Gaines methodology or something to that.
Yeah, but dual stem is basically what it is. It's a combination.
And it's
of both.
different because it's different equipment. You're using both.
Well, I'm using FDA-approved equipment, and the specs. Really, there's a number of companies. I prefer only 2 or 3 of them, but these companies have FDA-approved equipment. These shockwave generators or pulse wave generators are actually approved for plantar fasciitis, lateral epicondylitis or tennis elbow, and temporary increase in blood.
That's actually an important point because many doctors nowadays are having, especially recently, having problems. Let's say they want to place a Google ad or a Facebook ad, but Google's actually officially banned what might be referred to as a regenerative medicine ad. But you could advertise as you're using FDA-approved equipment,
Yes,
past equipment, or
absolutely.
for plantar fasciitis and other things.
You know, many
Non-surgical.
drugs and equipment are used off-label without any problems, and almost 50%. So this equipment I'm using off-label, it's FDA approved. I'm using it off-label.
But then we know, for the most part, it's FDA approved and it's safe.
Safe,
At least the
absolutely.
government believes it's safe, right?
Yes, it's very safe. The other thing is these pieces of equipment actually have other medical uses. I mean, I told you plantar fasciitis, lateral epicondylitis, but it's used
Kidney
for
stones.
many other things. Well, the kidney stones is really it's 100 times more powerful. It's a focus machine that focuses on the stone and obliterates it. So it's the gold standard for lithotripsy, kidney stones. But generally, it could be used for. I have patients coming in and I discover they have plantar fasciitis.
Could you ask?
Give them a
Could
treatment
you
that
ask?
is cured.
You answer. We get right to it and answer another question for the viewers of Top Doctor. When are you going to have? When are you going to be able to start teaching people?
Yeah,
When is it going to be available?
I've been asked this for a while. I have the training all together. We're ready to go. I have other things going on too, and we'll probably, along with a study that I'm doing, I've submitted for an IRB, and we're going to use homologous biologics with and without.
That's really important because in order to follow the rules,
Yes.
a lot of people aren't following the rules. You're going to use homologous. You're going to use whatever biologic product you're going to use,
Right.
and you're going to be able to clearly demonstrate its homologous use.
Right, and it's going to be. I'm going to use dual stem therapy with and without this homologous biologic. So.
Give an
I
example.
will be administering saline in place.
Got it.
This study is going to be lab funded. There's no.
Oh, so you can't charge
I'm not charging.
Mr. Jones $1,000 extra for saline?
No.
That's pretty
I'm a good
expensive
guy.
for salt water, right?
I wouldn't feel right about that, and I'm very happy that I can offer these things to the patients, and it's being funded by laboratory. So it's very.
How many doctors are you going to allow to participate?
I have a few on.
Because it's got to be paid for. That's the you
Yep.
can't do every doctor in the world.
Exactly. So I have a few that we've talked, and I'd like to have 10, and maybe get 5 to 10 good patients that fit the inclusion criterion for my study. We'll get it all together. It's going to be it'll be 6 weeks, 1 treatment per week, and the biologics or saline will be administered first treatment, third treatment, sixth treatment. There'll be followed up for 1, 3, and 6 months, and we'll get a study out of that, and we'll collect other data too that we'll publish later.
So one other quick question: when you were going to Harvard, your mom must have been so proud. Did she ever think you would be like the penis doctor?
No, I got a good story with that one.
Oh, don't tell it now. We're at a time limit here.
No, I never thought I would be either, but you know, it's one of the things that the goals of my patients. You know, body
The
composition.
good news is my son went to Harvard.
That's right.
So the other question is then, when do you think a start date is for training? Do you know what it's going to cost?
No, it's not going to cost a lot because
You want to get a lot of people doing it.
I want to have people doing this and be able to offer this to their patients. I've seen really incredible things going on with this, even better than anything on the market. So I am shooting for a time in late January or early February to get this all together.
What about the study?
In the study, I want to get going about the same time, but I'm going to solicit some other doctors.
The doctors are going to need both types of equipment,
That's
correct?
right. That's really.
But they're going to be lucky doctors because, I mean, even if you, because the Focus Wave is a little bit more money.
much more money.
So if you, but just 5 patients, let's just say made, I mean, I'm going to estimate because I know that, let's say made 3,000 a patient, you know, it's, you know, 5, you're halfway there to paying it off. You
Yeah.
know, in 3 months, it'd just be profit, right?
Yeah,
For a
well,
doctor.
yeah, but the study.
And that's keeping the fees reasonable. I know a lot of men would pay, you know, $3,000 or $4,000 to fix a certain problem.
Right.
I know a lot of their wives would pay that too, girlfriends.
So absolutely, it works, and I can tell you that you mentioned how much money they make, but during the study, this is going to be funded,
Yeah,
it's
got it.
funded by the labs. Okay, so
So this could be quite expensive. That's why you can only have 10 lucky doctors.
exactly, and I want them to have 5 to 10 patients in my inclusion criteria.
So how many times are you
Then
going
we'll
to
get
use
that
the
study.
biologic? Just once or twice?
No, I mentioned
Yeah.
the first dual wave, the dual stem treatment. Excuse me, the third dual stem treatment, and the 6th. It's either going to be saline or the biologic.
So 3 times.
3 times.
So one lucky person is getting the biologic, which is going to pass the homologous use test, right, for the FDA and
Yes.
361 guidelines, right? And then the other patient is going to get the saline.
Yeah, but don't forget, they're going to get saline, but
But they're also going to
dual
get
stem.
folk, yeah, correct.
If they're getting dual stem therapy, they're going to have some good results anyway. We just want to see if they get more rapid results with the biologics or improved results.
Okay, so this is absolutely fantastic. I want to ask more questions, but we want the people to come back and ask more questions
Yeah.
anyway.
We're here.
And we know a lot of doctors out there have a lot of questions. So let me just point out how they can either get on the list or list to get more information. If you go to info@topdr.com, DR like doctor, info@topdr.com, and just point out in the email that I'm interested in Dr. Richard Gaines or anything Dr. Richard Gaines is doing. info@topdr.com. It's a pretty easy URL. Sorry, I combined that. I want to really thank Dr. Richard Gaines today because this is probably one of the more interesting interviews that we've had. And I just want to point this out. A lot of people, you know, kind of uncomfortable talking about these topics. You make it really easy because you're kind of comforting.
Yeah.
And then I think a lot of people are gonna be interested in this, but somewhere down the line, I think you're really gonna have to address some of the female, and it's almost like female erectile dysfunction.
That's right, and there are homologous structures, and females and humans also. They have blood flow issues.
I mean, technically, the clitoris, when you look at it, it's almost identical to the
It
penis.
has crura.
It's smaller.
It has crura. It has everything. So I know it works because I've offered it to female patients, and they've seen good benefits.
So once again, the study probably by February, training probably sometime before the end of January by February, costs, training details, some online maybe, some in person or a combo.
Well, it'll be online. They'll know what they have to pay when they get there.
Okay,
Before they get there.
got it. You don't want to send them in with a hammer right away, right?
No.
No, a lot of men won't like that. Once again, for more information or to get on the list of interested parties about Dr. Richard Gaines' new dual wave therapy, I guess we're calling it. It's patented as dual stim.
Dual stim.
Go to email info@topdr.com info@topdr.com. Thank you so much, Dr. Richard Gaines.